Hey, welcome back to Tea with Tanya. If you're listening to this episode, I hope this episode finds you well and in good spirit and you doing something each day to make your life better or doing something to make yourself feel good. Thank you for joining me here in the tea tasting room. Today, I'm going to briefly be talking about pregnancy and anxiety. But before I get into today's episode, I have an affirmation I want to share with you. And it's very simple. It is, I can do hard things. I will say it again. I can do hard things. Life is all about challenges. Every day may not go as planned, but always remember as you go about your day to day tasks, your weekly tasks, remember this: I can do hard things. Even in the midst of whatever challenge, sometimes you may end up doubting yourself, thinking, I'm not able to do it, I'm not capable. You can do hard things, you can do things that are challenging, but also bear in mind that you don't want to push yourself too much. Know your limits as well, but also remember that you can do hard things. Whether you tackle that hard thing today or you have to push it until another day, that's fine. But just remember that the task is going to still be there and it's still going to be challenging, but you can do it no matter what. Now, I'm going to talk briefly about pregnancy and anxiety as I get ready to wrap this series up. And I'm decided to talk about pregnancy and anxiety very briefly because I will have a podcast episode that's coming up with a trained therapist, a trained perinatal mood disorder professional. But this topic was on my mind from dealing with my own clients from an individual standpoint, but as well along with my day to day job and having seen people are just anxious and the different myths that they are out there about pregnancy as well. But I am going to briefly talk about pregnancy and anxiety. Now, I want you to know that pregnancy can and should be an exciting time for you as a woman, for as a birthing person. Pregnancy is an exciting time and it should be nothing more than that. But it can also be a time of great anxiety, which is often warranted because the fear of the unknown, not knowing what's happening, carrying a life, that's going to have anyone's anxiety through the roof. Okay. For me, as a regular smuggler person, the things that I get anxiety or I get anxious for. So can you imagine when you realize that you are expecting and you're now caring for life. So the fear of the unknown sometimes can heighten your anxiety. Anxiety disorders are the most common mental health disorders during pregnancy, with up to 15% of pregnant women experiencing them. In this episode, I will be exploring the prevalence of anxiety during pregnancy, its causes, and its impact on maternal and fetal health. Research has shown that anxiety disorders are more common during pregnancy than depression. One study that was published in the Journal of Affective Disorders found that up to 15% of pregnant women experience anxiety disorders. This is higher than the general population, where anxiety disorders are estimated to affect around 10% of adults. So some causes of anxiety during pregnancy. There are many reasons why a birthing person or a woman may experience anxiety during pregnancy. One, let's think about the hormonal changes. Now, we all know as someone who menstruate on a monthly or regular basis, the hormonal changes that comes with that. So when you think about pregnancy, the hormonal changes is even more heightened. The physical discomfort and the worries about the health of your baby are just a few common causes. Just a few, because I'm sure there's a lot more that you're probably thinking about. What clothes am I going to wear? Sometimes it could be the most trivial things, but these are just a few common causes of anxiety. And then, of course, women or a birthing person who have a history of anxiety or depression may be more prone to experiencing anxiety during pregnancy. Also, it's important to know that during pregnancy, when we talk about hormonal changes, you have the levels of estrogen and progesterone tend to increase drastically, significantly, which can affect mood and anxiety levels. And there are other factors that can contribute rather to anxiety during pregnancy. And these are such as, previous history of anxiety or depression, pregnancy complications such as gestational diabetes or even preeclampsia, and then, of course, financial stress. That's also another factor that can heighten and contribute to anxiety when you're thinking about having, especially living in the climate that we're living in now with inflation and everything is just so expensive. Like I often joke, but it's not even necessarily a joke, talking about, with the running joke that I've seen on social media is if you are able to afford eggs, you are quote unquote rich, and it's just it's a running joke. But the inflation, the times that we're living in, things are getting expensive. And when you think about having to bring a baby into this world, while it is a beautiful and sacred moment and sacred time in your life, financial stress can be a factor. It could be because a pregnancy was not planned and you were not where you wanted to be financially. Because these are factors that I even consider when I'm thinking about having a child. It's like, wow, am I going to be able to financially support someone else? It could be you just lost your job or you just started. It could be so many different things. So financial stress is also contributes to anxiety during pregnancy. And then we think about relationship difficulties for a number of reasons that I don't want to necessarily go into because I don't want to cause any issues. But you think about you getting pregnant, maybe not one partner may not. Again, this is if the pregnancy probably is unplanned as well. That partner may not be ready and willing or was not ready to have a child then because they had other things they wanted to think about, or the relationship was probably under rocks before. So now you're thinking, now that I'm pregnant, it's just going to save the relationship. What's going to happen? So relationship difficulties, and it could also not be with your partner, but it could be from family. Again, any sort of relationship that's important to you. And then, of course, there is the fear of childbirth, and of course, the lack of social support, which is also a big thing. So these are some things that contribute to anxiety during pregnancy. And anxiety is important to know that anxiety during pregnancy can manifest in a variety of ways. These could include racing thoughts. Now, granted, I am not pregnant and I do have racing thoughts, but again, these are things that can heighten and, it manifests itself. Racing thoughts, heart palpitation, difficulty sleeping. Bear in mind, you're already pregnant. Depends on where you are in your pregnancy. So sometimes even laying on your side or your stomach or whatever you're used to, that in itself is also uncomfortable and can already contribute to your difficulty sleeping. So can you imagine you're tackling that with anxiety? It is going to contribute to difficulty sleeping. Other symptoms such as irritability. Sometimes we're hearing our partners saying, "Oh, she's miserable," or "She's just always annoyed or angry." Sometimes that's because one, anxiety can also contribute to that irritability, restlessness, the need or always feeling on edge. So it's very important to recognize these symptoms and seek help before they end up interfering or causing issues in your daily life. So sometimes, you know yourself more than anyone. And sometimes, it's good to have a good support system, someone who knows you, who can see that you are quote unquote crying out for help without actually crying out for help. Sometimes, granted, that's not everyone's situation. Again, like what I mentioned, lack of social support, lack of, relationship difficulties could also let someone feel isolated during their pregnancy, and that could cause anxiety. So it's important for you as an individual, as hard as it may seem, it's important for you as an individual to be able to recognize some of these symptoms. If you know you're a person who are always calm, or even if you're a person who are somewhat always anxious, but you realize that you're much more anxious, much more irritable, much more restless. These are things to think about and realize that okay, these are elevated, they're heightened. Let me speak to my care provider, let me talk to a friend, someone who you have that you can trust and depend upon. You talk to them to explain your symptoms, what's going on. So one, they can ultimately, one, get you help, or they can show up for you in a way that they probably weren't at the time and be of support to you. Impacts of anxiety during pregnancy. Again, as we know, anxiety can have a significant impact on maternal and fetal health. And some of the potential effects of anxiety on the mother or the birthing person, this includes the increased risk of postpartum depression, the increased risk of preterm birth, which we don't want that, the increased risk of complications during delivery. That is something that we also do not want. And I'm just going to put a shameless plug here. That's why it's important to also have a doula. Because again, like I would have mentioned, you may not have that support from family, from friends, socially. That's when you reach out to a doula who will be that person who will be your support person throughout your pregnancy and after, and to ensure that you are as calm as possible during the birthing process. Other potential effects could be increased risk of developmental delays in the child, increased risk of behavioral problems in the child, and anxiety can also affect the fetus. So, like I just mentioned, some of these significant or potential effects of anxiety on the birthing person, which is again, increased risk of postpartum depression, increased risk of preterm birth, increased risk of complications during delivery, increased risk of developmental delays in the child, and increased risk of behavior problems in the child. Studies have shown that high levels of anxiety during pregnancy can lead to low birth weight, premature birth, increased developmental delays, and increased risk of behavior problems to your child. So it is important to work on reducing stress and anxiety during pregnancy, not just for your own well-being, but for the health and development of your baby. Believe it or not, you're sharing that one body with you and your baby. Babies can we often say that babies can sense when something is wrong with their parents. And that's not just when they're out of the womb. That's also during that pregnancy. I know it's easier said to work and reduce stress and anxiety, but you have to work towards being intentional. Sometimes there are environmental factors that sometimes, like myself also, we become stressed and anxious, but it's important to work towards trying your very best to reduce stress and anxiety during pregnancy just for your overall well-being and the well-being of your child. I want to talk about managing your anxiety. Like I said, I'm not going to go too deep. I want to talk about managing anxiety during pregnancy. Now, there are many ways to manage anxiety during pregnancy. Exercise is one of them. I would have mentioned in the previous episode the importance of physical activity and the effect it has on your brain and your body and your overall health. So, exercise, relaxation techniques, even seeking professional help are all effective strategies and ways to help to manage your anxiety. We know exercise is one that has been shown and proven to reduce stress and anxiety. And of course, it helps to improve your overall health and well being. We talk about relaxation techniques that includes deep breathing. That's one thing as a doula, we're always going to encourage you to, we're going to teach you different breathing techniques. So, deep breathing, meditation, even prenatal yoga, like I would have mentioned in that previous episode, can also be helpful in reducing and managing your anxiety during your pregnancy. And also, reach out to a therapist, a social worker, a licensed social worker, a therapist, a counselor, whoever it may be. Reach out to someone that you can trust and develop that relationship where they can provide you with coping strategies, that they're going to give you that toolbox so you can pull out a coping strategy based on how you're feeling, and also offer support and guidance as you navigate this exciting and happy moment in your life, even while it can be somewhat challenging. There are also other treatments. Like I said, so you want to be in tune with your body. Don't hesitate to ask for help, because we, as your support person, we can only assume, we can observe certain behaviors, yes, but you have to communicate with your support team, however that may look. And of course, don't be afraid to reach out to a professional to help you with your anxiety. It is a real thing, and you want to be able to enjoy the beautiful moment, the journey to motherhood. You want to be able to experience that. I will say, if things get a little bit out of control, there are treatments for anxiety during pregnancy, which can be effective. One of the most common or commonly used treatment is called CBT, and that's cognitive behavioral therapy, which is a form of talk therapy that helps people or helps you identify and change negative thought patterns and behaviors. CBT has been shown to be effective for treating anxiety disorders during pregnancy. So it is pretty common, but of course you have to seek help from a trained professional in order to receive this type of treatment. And of course, there's also medication that can be used to treat your anxiety during pregnancy. And of course, they should be used with some caution. But that is, if I can be honest, outside of my scope because I don't want to get into, as much as I've done my research, I don't want to get into the types of medication and the different other treatments. It's outside of my scope, and I will leave that to the professional that I will be speaking to in an upcoming episode. But there are medications if it gets that to that point. There are medications that you can take, but of course you want to exercise caution. And I will put in here. This is the time where you have to be an advocate because you're your biggest advocate. But of course, if you have the likes of a doula, a partner, support team, family that can speak for you or encourage you to speak for yourself, that's fine. But this is where you advocate. Should it get to the point where you are needing medication, you want to ask all the questions you can possibly ask. What effect does this have on me as a person in my day-to-day life? What effect is it going to have on my baby? All these are questions that you have to ask before you go the route of wanting to take medication because it has to be safe for not only yourself but also for your baby because there are some medications, some anxiety medication that can be harmful to your baby. I will say that, but it's important to ask these questions and do your research as well before you use this form of treatment. But CBT is pretty common, and that's the way. Again, just reach out to your support team or even create your support team because again, everyone's situation is ultimately different. So you want to create and cultivate a support team during this most joyous occasion of your life. So again, as I'm wrapping up, like I said, I was going to be brief, but it was on my heart and I wanted to touch on this because I have noticed a lot of first time moms, or even if it's your fourth child, you have that anxiety. And just as a parent, I cannot speak from a parent perspective, but even as an aunt or just have with friends who have kids, you become anxious because we live in a cruel world, one. And then you also want to make sure that you're doing everything that you possibly can to be safe. So, of course, you're going to have some sort of anxiety throughout your pregnancy. Am I eating the right food? Am I working out too much? Am I drinking enough water? All these are different things to consider. And I just mentioned water. So I do want to say if you're doing again, physical activity can help you to reduce your stress and anxiety. It's very important to stay hydrated as well throughout your pregnancy. But anxiety during pregnancy is common. It can have a significant impact on maternal and fetal health. So it is important for you, as an expectant mom, to seek treatment if you're experiencing anxiety. CBT, also known as cognitive behavioral therapy, is a safe and effective treatment option. But medication can also be used should it come to that. So if you or someone you know is struggling with anxiety during pregnancy, please be sure to seek help from a healthcare provider or encourage that person to seek help from their healthcare provider. It is treatable. Some other strategies for managing anxiety during pregnancy, again, includes exercise, relaxation technique, seeking that professional help, or communicating with someone as in your support team or support system so that they can encourage you or they can be that advocate for you to encourage you to get help. And just remember, guys, as I wrap up, you don't have to navigate pregnancy and anxiety alone. There are many resources that's available to you. And then again, you invest in a doula. There are doulas who are willing to work with you no matter what your socioeconomic status is. If you're not someone who has the support that you need, again, invest in a doula or a partner. We spoke about birth support partner by way of it could be the partner for who you're parenting with. It could be a sister, a friend, something. But it comes down to, again, communicating your needs and expressing and being in tune with your body so that these people can understand that you are dealing with severe anxiety or you need to seek some form of treatment. But thank you for tuning in to this episode. I will definitely see you in the tea tasting room on the next episode. I hope this helped. Again, this is just the basics of pregnancy anxiety. I will be going more in depth with my upcoming guests as we tackle this topic more because it is deep. We can get deep, but I just wanted to provide you with a very brief episode about pregnancy and anxiety and how you can start coping until you're able to get to that point where you can get help. So don't let it get the best of you. And again, that's easier said than done. But be in tune with your body and find ways that you can help to reduce your stress and anxiety as best as you possibly can. And don't hesitate to reach out to your healthcare provider and your support team. And that's all. I will see you in the tea tasting room next week. Have a great day.